As we continue to wait for a vaccine, many who have contracted COVID-19 are wondering why the recovery time lasts so long. Well, Director of the National HIV and AIDS Infectious Disease Program, Dr. Nakia Forbes, gave this breakdown on what happens in an infected person.
When someone gets COVID-19, they're infectious even before they start to have symptoms. That's very important when we think about the fact that people can look fine, but they could still have COVID-19 or be infected with SARS-CoV-2, that's the virus that causes COVID-19, they can spread it to others. Those people that develop symptoms, it's going to be somewhere in what we call the incubation period. That varies, but on average, it's about 5 to 8 days after they come in contact with it. It can be as high as 14 days. But that being said, the incubation period is that time in which someone has the infection, but they have not yet started to exhibit symptoms. When they start to exhibit symptoms, they're infectious in that time period. Usually most infectious, based on our understanding, when they have the most symptoms, a high fever, cough, runny nose, is probably when they're the most infectious. This usually is in the first days or maybe a week when they first contract COVID-19.
Now, there remains no cure for COVID-19, but Forbes notes the body can overcome COVID-19. She explains what it means to be recovered and when a person can no longer transmit the virus.
People who have a normal immune system, who have mild to moderate COVID-19, it is 10 days from the start of their first symptom and at least 3 days from since the last symptom with significant improvement of their fever has gone away, their cough is not worsening, they have no ongoing diarrhea, abdominal pain, muscle aches, and chills, for example. Okay? And for people who have a normal immune system, we can use that definition to say that they are recovered from COVID-19 and should no longer be infectious. This period of time is different for people who may have had a more severe illness or who may have an impaired immune system. Say, for example, a patient who is a cancer patient on chemotherapy, or they are on high-dose steroids and they have a worse course. If they're sicker, then the definition is 20 days from since the first symptom, and again, at least 3 days from since the last major symptom.